We've also we will be having the family sometime next week to inaugurate the AB Puma building as the national headquarters of the Department of Health. Even at that time already outlined the kind of future health system which was required in the country. In one of the clauses of the document, I quote, it says, it calls for the establishment of free medical and health services for all sections of the population. That is in 1943. While the other clause calls for, I quote, a drastic overhaul of the health services of the country with emphasis on preventative medicine. That's that time. So those many years, almost 80-something years ago. But the journey to today's landmark moment also was started as early as our first democratic dispensation, 1994, with the post-apartheid government laying the foundation for the health reform. Over the decades, numerous committees, inclusive of diverse professionals and stakeholders, have been diligently working to shape the future of our health system. And I'm happy to see many comrades who are part of many of those discussions day and night, when we hammered out the various issues. Through extensive public consultations and after assimilating numerous comments in the new government, in the new dispensation, a green paper was developed, ultimately leading to a white paper which laid the groundwork for the NHI bill ultimately. Within our context, historically, healthcare costs have unfairly burdened most vulnerable members of our society for a long period. Families have faced agonizing decisions, sometimes having to choose between basic necessities and the necessary medical care. This reality does not align with our vision of the country where we envision citizens should enjoy a life to the fullest. The inequities and inequalities that characterize our health systems are unjustifiable and require fundamental overhauling to ensure equity and sustainability as called for as early as 1942-1943. As we steadfastly continued with our efforts towards realizing a healthier, more prosperous South Africa, we must recall also the Freedom Charter, which says, quote, a preventative health system shall be run by the state, and free medical care and hospitalization shall be provided for all, with special care for mothers and young children. That's the Freedom Charter, 1955. Leveraging the values and principles espoused in the Charter, the NHI has been under serious consideration since the dawn of our democracy. The primary objective of the NHI reforms are directed at unifying our fragmented health system and ensuring that Section 27 of our Constitution is realized, which guarantees access to health for all in the country. And it's even broader than just citizens, but access to all in South Africa. Informed by also the National Development Plan, which outlined a framework for ensuring that by 2030, South Africa should have achieved a significant shift towards equity, efficiency, and quality of health service provision, as well as realizing universal health coverage. So that's the policy framework also, which informs the fundamental principles of the NHI. The implementation of this NHI is therefore not just a policy issue, it's a commitment to the well-being of all South Africans. It is important to emphasize that this policy development, as we have mentioned, started in the early 2000s with a green paper and ultimately reaching to the legislation. And there have been several consultations processes undertaken with all the inputs and comments which have also been taken into consideration to make sure that many South Africans played a role in the framing of this act, this bill, which is soon to become an act. It was submitted it was approved by Cabinet in July 2019 and then submitted to Parliament, which then started the process of processing in the National Assembly under the leadership of the now Deputy Minister and former Chair of the Portfolio Committee, Deputy Minister Jomo, enabled by the whip of the committee, Comrade Honorable Munyai. Good to see you, sir, being here, having been the whip of the committee, always whipping us to make sure that we can drive this process. Following further consultations and appropriate amendments, the Assembly passed the bill in June last year, and then from there was referred to the National Council of Provinces. I see also our chairperson of the NCOP also being here. Thank you very much, Honourable Member, for also steering this process. And finally, on the 6th of December, the NCOP passed this bill by support of 8 out of 9 provinces. And it is then that... So anybody who claims that this was parachuted and there was no proper consultation, this process just within the NCOP, there were more than 60 public hearings in all provinces. Almost every district was given a chance. Various submissions, all of them were taken into consideration. And subsequently, therefore, was referred to His Excellency President. We are happy that after many years of policy discussions and 5 years in Parliament, this bill is now it's reached the stage where it is now, which allows that once it is enacted, which will allow the Department of Health to commence with implementation and to create the mechanisms for equitable, effective, and efficient utilization of the resources available to the country. Because the reality, as we say to many naysayers, South Africa is not short of resources. We're already utilizing 8.5% of our GDP for health. Within the public sector as well, already reached the Abuja declaration of 15% in the allocation of the budget. What is required is that almost 51-52%, which is used for only 15% of the population, must be integrated to be fully utilized for the whole population. So, ladies and gentlemen, we are happy to be here today to bear witness to this seminal moment in our history. We stand resolute and committed to realizing a health system that ensures that our people enjoy healthy and productive lives, spurred on to achieve their full potential in a more equitable country. This law is not just a policy, as I've said, it's a promise. We are making a promise to our people for a better and more healthier future for all South Africans. It's not partisan. For those who may be told lies that this is electioneering, is what. This is for the betterment of all South Africans, we want to emphasize. This law represents a comprehensive, transformative approach to health delivery. It is founded on the principles of equity, sustainability, fairness, social solidarity that ensures that every South African, regardless of their socio-economic status, should have access to comprehensive health care. And now that the bill is soon to become an act, it creates a statutory mandate that will enable the establishment of the key institutions and the organizational structures, key to which will be the actual National Health Insurance Fund and its various governance structures, which will be established once all the various key provisions have been proclaimed. We must, however, emphasize the fact that this is not going to be a once-off, event. It's going to be a process. The bill itself outlines various phases, so we're going to follow the phases as outlined. Our intention has always been to implement in a rational, structured, and phased approach. The Constitution does empower the President to set different dates for effectiveness of clauses of an act. Therefore, the phased implementation of the Act will be undertaken with due consideration to all the specific sections when they are ready to be implemented, proclaimed and implemented, and will also have to follow the steps in terms of regulations, directives, and all that. All those are outlined in terms of our Constitution and law, even in the bill itself, the various processes of consultations, 90 days in most cases in terms of regulation. So we are going to be able to follow all this and finally establish a Schedule 3A entity in terms of the Public Finance Management Act. The Act, of course, does empower the minister to appoint a board, but also it's very clear that the people who are appointed there must be people of good standing. There will be a public process. All those will be done accordingly. There will be regulations, and all the regulations will provide all the processes. So we do expect that all these processes, which have already started in anticipation, we already have some of the drafts, that within 6 to 12 months, the institution, at least the fundamental structure, will be established. Within 6 to 12 months, we expect that with all the groundwork which has been done, this will be so. There will be some challenges, but we believe that we will overcome all those obstacles. So there's been a lot of work done. So we want to invite all the role players to join us in this journey and to become part of the solutions rather than be part of the obstacles. And I want to specifically invite especially our healthcare workers and professionals to say to them, don't listen to the doomsayers. Don't listen to the doomsayers. There are, scaremongers out there who are telling them things are going to collapse. You must leave now. Now that the president has found a pen, found the next flight, stay here. Things are going to be better. That's what we want to say to our professionals. We're going to make sure that what has been achieved over 30 years can only get better and not get worse. Ladies and gentlemen, it's now my honor and privilege to invite our Commander-in-Chief, who led us in the worst of times. I know many of you forgot that there was something called COVID already. You've forgotten the family meetings. You've forgotten. Now, this is our leader who led us through those very important family meetings at difficult times, not only in the country, but in the continent and also in the world. But I must say also to the doomsayers, this is the president who's also leading us out of load shedding. I'm sure even those who have been skeptical must now accept that we're making progress. Almost 50 days and counting. So even this one is going to succeed. Honorable Excellency President Ramaphosa, I invite you to address the nation.
Thank you. Let's be seated, please. Dr. Joe Pasha, Minister of Health of the Republic of South Africa. The MECs of Health from a number of our provinces. Who are here present, representatives of Labour, representatives of various political formations in our country, members of Parliament, particularly the Portfolio Select Committee members, whips and what have you, public representatives and members of the media, distinguished guests, and ladies and gentlemen. We are gathered here today to bear witness to the signing into law of the National Health Insurance Bill, which at the stroke of the pen is about to become an act of Parliament. This is clearly a pivotal moment in the transformation of our country and, in fact, in the history of our country. It is a milestone in South Africa's ongoing quest for a much better, just society. This transformational healthcare initiative in many ways gives further impetus and effect to our constitutional commitment to progressively realize access to healthcare services for all its citizens. In its essence, the National Health Insurance is a commitment to eradicate the stark inequalities that have long determined who receives in our country, who receives adequate health care, and who suffers from neglect. By putting in place a system that ensures equal access to health care, regardless of a person's social and economic standing and circumstances, the NHI takes a bold step and a stride towards a society where no individual must bear an untenable financial burden while seeking medical attention. Now, this vision is not just about social justice, and this vision is not a new one, as you have heard, and I'll refer to it a little later. It is also about efficiency and quality. The provision of healthcare in this country is currently fragmented. It is unsuitable and it is wholly unacceptable. The public sector serves a large majority of the population but faces budget constraints. The private sector serves a fraction of society at a far higher cost without a proportional improvement in health outcomes. Now, addressing this imbalance requires a radical reimagining of resource allocation and a steadfast commitment to universal health care, a commitment we made to the United Nations. And let it be clear that universal health care is a global initiative in many ways, where a number of countries are moving towards universal health care, and we as a country have made a global commitment that we are going to have universal health care. So those who are trying to hold us back to a fragmented system are completely out of line with the global vision that has been set, which we are a part of. Remembering that South Africa is part of the global community. So we are not mad. We are not outliers. We are very much in line with what is happening in the global community. The real challenge in implementing the NHI lies not in the lack of funds, but in the misallocation of resources that currently favors the private health sector at the expense of public health needs. That's where the problem is. The NHI bill presents an innovative approach to funding universal health care based on social solidarity. And solidarity is important. It's an important concept, and I digress for a minute by also reminding us that when we faced a global challenge which was brought about by COVID-19, we harped on the issue of solidarity. And we kept saying we want international solidarity so that those countries, particularly in the Northern Hemisphere, who have been able to have much better systems, aided and abetted by the colonialism, the empowerment that they received from raping and pillaging the resources of countries that they had colonized, that they must pledge solidarity. And we did so when it came to vaccines, we did so when it came to PPEs, we did so also when we came to debt relief. And we said, we need solidarity. And it was embraced to a large extent, even by those in the Northern Hemisphere. So this proposes this concept of Solidarity proposes a comprehensive strategy that combines various financial resources, including both additional funding and reallocation of funds already in the health system. This approach ensures contributions from a broader spectrum of society, emphasizing the shared responsibility and mutual benefit envisioned by the NHI. I repeat, the shared responsibility that we all have as South Africans. Now, the financial hurdles facing the NHI can be navigated with careful planning, strategic resource allocation, and a steadfast commitment to achieving equity. And let me repeat, achieving equity. And I want to emphasize this point, that achieving equity is what the struggle against apartheid has been all about. And it continues to be about that we should have equality. Now, we cannot have a situation where there is a portion of the South African population that continues to live under an unequal system, whilst the others continue to live under a privileged type of system. This is completely against what the ethos of our democracy is. So for those who would like to see those privileges that they've continued to enjoy continuing, sorry, you are on the wrong boat. The boat that we are on is about equality. Now, the NHI carries the potential to transform the healthcare landscape, making the dream of quality, accessible care a reality for all its citizens. Now, I will not go into the criticisms that have always been levied about this type of system we want to establish. The NHI Fund will procure services from public and private providers to ensure all South Africans have access to quality health care. The NHI recognizes the respective strengths and the capabilities of the public and private care health systems. Now, quite often it is said that the private healthcare system is the real backbone of our health and they have the best of everything. And they always try to downgrade the public health system, and in fact, in a very insulting way, they dismiss it completely. But let me tell you something, what we are trying to build is a Rolls-Royce system of healthcare for all South Africans. That is what we are trying to do. Now, it aims to ensure that we complement the systems and reinforce them with each other. Through more effective collaboration between the public and private sector, we can ensure that the whole is greater than the sum of its parts. The effective implementation of the NHI depends on the collective will of the people of South Africa. We all need to embrace a future where healthcare is a shared national treasure, reflective of the dignity and the value we accord to every South African person's life. Now, I know that there are fears, and earlier we were at the Elijah Bahai inaugural lecture, and I spoke about the fears that a number of South Africans had. Firstly, with the right to vote that all South Africans would have. A number of South Africans were terrified that all these many South Africans, largely black, would now have the right to vote. And they were so terrified. Some of them started collecting tinned food, putting it in their cupboards, in the hundreds of tens and so forth, fearing that a calamity is about to descend on them. We all won the right to vote, and nothing happened. Only progress that started building our nation. And then I also spoke about the right to strike. And the employers were so terrified that these hordes of workers are now going to have the right to strike, and it's going to destroy the economy. Instead, having won the right to strike, we have been able to grow this economy almost threefold since the days of apartheid, showing that there was nothing to fear. They were just fearing ghosts. So now today I say, with the national health care, those who are fearful, those who are afraid, and I say, just think about the commitment that the governing party has always had to building South Africa as a sustainable, growing nation. And this is what nation building is all about. National health care on a universal basis is going to build our nation in a very practical way. Now, preparations for the implementation of NHI necessarily requires a focused drive to improve the quality of health care. We have already begun implementing a national quality improvement plan in public and private healthcare facilities, and we are now seeing vast improvement. And let me say, we are seeing vast improvement, even in areas where we never thought we would see improvement. In the deep rural areas of our country, we're really seeing great improvement of health facilities. Even in our townships, where even old people go and no longer need to queue up, for instance, for getting their critical care medication. They get it through computer calculations, and they just go and pick their medication up from cubicles. And that is what improvement of healthcare is all about. It's happening in the townships. I go to the deep rural areas in Limpopo, in KZN, in Northwest, and I go to hospitals right in the rural areas. And I'm always amazed that they have the same machines, MRI machines, whatever they are called, right in rural areas. Machines that are able to beam information immediately to doctors in Johannesburg, to doctors wherever in the world, and they are able to do the diagnosis. That is the journey we have embarked upon. Now, that is the improvement of our healthcare. Now, the detractors always talk about the very negative, where we are effecting improvements, where they will talk about, the shortage of this headache pill in hospital X or in clinic Y and so forth. And then they want to bring the whole temple of NHI down. And we say, no, we are improving. Now, in signing this bill, we are clearly signaling our determination to advance the constitutional right to access health care, as articulated in Section 27 of our Constitution. Remember, Section 27 of our Constitution is what we all, as South Africans, said we wanted. We went across the length and the breadth of the country, consulting our people, and our people said, we want those who are going to finalize the drafting in the Constitutional Assembly to insert this type of clause in our Constitution. And the Section 27 says, and I want to read it, it prescribes that everyone has the right to have access to health care services, including reproductive health care. And it goes on to say the state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of each of these rights. And it goes on to say, no one may be refused emergency medical treatment. But if you read it more carefully, it says, no one may be refused medical treatment here in South Africa. That is what the people of South Africa wanted. And this is what we are signing to today. That's what we are signing to. Now, Minister Patla referred to the African claims on health. I want to refer to that as well, because this has been an 81-year struggle. Conceived in the African claims and inserted in that claim is the following. They had a paragraph talking about public health care and medical services. And they said, we regard it as the duty of the state to provide adequate medical and healthcare facilities for the entire population. Carefully listen. Not for a section of the population, for the entire population of the country. We deplore, they said, 81 years ago, and deprecate the fact that the state, and they used to use good English, we deplore, and they were very educated, these, we deplore and deprecate the fact that the state has not carried out its duty to the African in this regard, and has left this important duty to philanthropic and voluntary agencies. As a result of this gross neglect, the general health of the entire African population has deteriorated to an alarming extent. We consider that the factors which contribute to this state of affairs are these: the low economic position of the African, which is responsible for the present gross malnutrition, general overcrowding, higher mortality and morbidity rates. Now, who are the people 81 years ago who penned down this African claim? I want to give you just an insight of some of them. Some of them. It was an R.G. Baloyi, who was the TG of the ANC, R.T. Bokwe, who was a medical doctor, Reverend James Talata, a priest and Secretary General of the ANC, Godlo, member of the Native Representative Council, Kabane, teacher, Moses Kotani, Secretary of the South African Communist Party, and member of the ANC, Mac Lipodisa, a trader, businessman, Reverend Zed Mahabane, Minister Chaplain of the ANC at the time, Makabani, Mapikela, Z.K. Matthews, Mbata, Govan Beki, Mwerane, who was a teacher, member secretary of the Natal Bantu Teachers Association, Mufusanyane, member of the committee NEC of the ANC, Molema, J.S. Moroka became president of the ANC, Mpitso, Tim Kulu, there were many Tim Kulus, Dr. Pixley Isaka Seme, who became the president of the ANC, Sitlogelo, Selepo Tema, editor of Bantu World, Kliniwe, A.B. Kuma was the president of the ANC, and. Now, this is a galaxy of really outstanding leaders of the African, of our people at the time. 81 years ago, were they mad? No. Were they clear about what was needed in this country? Yes. 81 years later, we are achieving the dream that they set out. Now, given that it took 82 years for the African National Congress, that's the governing party of this country to achieve the freedom that we today enjoy. It has taken 81 years to get an achievement of the African claims. And that is why I'm going to sign this bill. Now, the passage of the bill sets the foundation for ending a parallel, inequitable health system where those without means are relegated to poor health care, as described in 1943. Under the NHI, access to quality care will be determined by need, not by ability to pay. This will produce better health outcomes and prevent avoidable deaths, as they also envisaged in 1943. The NHI is an important instrument also to tackle poverty, as these leaders envisaged in 1943, as they said it was responsible for overcrowding, for poverty. The rising cost of healthcare makes families poorer. It is sad to hear families saying, and then I had to pay this amount, and that amount. By contrast, healthcare provided through the NHI will free up resources in poor families for other essential needs. And through this, we will be able to reduce poverty. We will be able to reduce inequality. And this is an essential step on our journey as a nation to make the lives of our people better. The NHI will make healthcare in the country as a whole more affordable. The way healthcare services will be paid for is meant to contain comprehensive healthcare costs and to ensure that available resources are more effectively used. Through the NHI, we plan to improve the effectiveness of healthcare provision by requiring all health facilities to achieve minimum quality health standards and be accredited. Following the signing of this bill, we will be establishing the systems and putting in place the necessary governance structures to implement the NHI based on the primary healthcare approach. Now, the implementation of the NHI will be done in a phased manner, in a phased approach, with key milestones in each phase rather than an overnight event. Now, some fear that yes, overnight, it is just boom, going to happen. And we are saying it's going to be phased. And if you are afraid of the NHI, take heart and courage from the fact that we are going to implement NHI in a phased manner so as to ensure that every sub-milestone becomes an important one to make the NHI much more effective. So that's what we are going to do. Fear not, I say, fear not. There's been much debate about this bill. Some have expressed concern, some have expressed opposition, and some have expressed support. What we need to remember is that South Africa is a constitutional democracy. We are a democracy. The parliament that adopted this legislation was democratically elected, and its members carried an electoral mandate to establish the national health insurance. So they did not just dream of it on their own, much as they were inspired by what the drafters of the African Claims said in 1943. But they were very careful in making sure that it goes through Parliament, various committees, various consultation processes, and it is carefully considered by all and sundry including myself as president. Having given it due consideration, I have now arrived at the conclusion that it must be an act of parliament. Because South Africa is also a country that is governed by the rule of law, in which no person may be unduly deprived of their rights. We have a clear Bill of Rights, we have a really robust constitution, so those who fear that this bill or this act is going to erode their rights, just be rest assured that there is a constitution, there's a Bill of Rights that protects all of us. We're a country that has been built on dialogue, on partnership, on working together to overcome differences in pursuit of a better life for all its people. The NHI is an opportunity to make a break with the inequality, inequity, and inefficiency that has long characterized our approach to health to the people of South Africa, as seen also in 1943. So I would like to say, let us work together in a spirit of cooperation and solidarity to make the NHI work, because the NHI is here, and it is now about to become an act of parliament as the law that governs health in the Republic of South Africa. I have found my pen, and it is now going to be signed. Thank you very much. I thank you all.
With an applause, another big round of applause. You may be seated. Thank you very much, Mr. President, for those inspiring words. You may be seated. Just a few acknowledgements of some of the dignitaries that have graced us with their presence to witness this momentous occasion. We have the World Health Organization country representative amongst us, Mr. Fabian Ndenzako. We also have the President and the CEO of the Health Professionals Council of South Africa. We have the Chair of the Portfolio Committee, Health Portfolio Committee, Dr. Jacobs. We also have the Chair of the NCOP, Health Select Committee, Mr. Zoisile Njandu. I'd also like to recognize all health professionals that are here with us, as well as leaders and representatives of big business that are also here. Also like to recognize Minister Nzimande. You're welcome, Perpetua. And also recognize Minister Chulas Nglesi, the Minister of Employment and Labor. And lastly, recognize Ubaba Utinangwe, the Deputy Minister of Health, Dr. Sibongiseni Dlomo. We also have, even though I said lastly, the DG in the presidency, Ms. Pindile Baleni, in our midst. And we also have the DG from the Department of Health, Dr. Nicholas Crisp, who has a lot of work ahead of him in ensuring. Oh, Buthelezi, sorry, my apologies. My apologies. Without any authority to do so. Shanga, welcome. My apologies. I think we are ready now to invite the President Is the pen there? Okay, the pen is there. To invite the President, the Minister of Health, as well as the emissaries of health to come to the table here so we can witness the signing. Denango, you can also join, please. Okay, if we may please sit it because we're blocking the view of the cameras at the back. This is a live event.
Signing here, I hereby, in terms of Section 84.2, read with Section 79.1 of the Constitution of the Republic of South Africa, 1996, assent to the National Health Insurance Act of 2023, Act number 20, and sign the English text thereof, given under my hand at Pretoria on this day, 2024. So I sign where it's written President. And I then sign where the act has to be assented to.
Thank you very much, Mr. President, and to the Minister as well as the emissaries of health. Yes, if the Minister and the Deputy Minister and the emissaries can remain in front for a picture, thank you. If you may remain standing so that, thank you. Oh, no. Please. Photographers in front, please do not block the cameras at the back. Thank you. If the team from the Department of Health is here, if they may please come forward and join the picture. Thank you. And that's all. Okay, ladies and gentlemen, at the conclusion... Okay, great. Okay. Okay, may the presidency team please join the picture. Advocate Mpafuli, Advocate Jele, please come forward. Just take off your tag. After this one. After the presidency team will invite members of civil society to also take a picture with the president. Okay, thank you very much. Mr. President, please remain in that position. Members of civil society, please come forward. Yeah, you take it at the end.
I spoke to him.